It's great that Governor Bill Lee is increasing funding for public education in Tennessee from kindergarten to higher ed, thanks to an infusion of federal money that Tennessee Republicans in Washington opposed. It's also good that Lee's administration plans to overhaul the state's education funding formula. And it's particularly commendable that he is proposing some $250 million to improve infrastructure at Tennessee State University, a historically black college that has been woefully underfunded for decades. All of those proposals were included in the governor's State of the State address Monday before a joint session of the State House and Senate. But there was one glaring omission from Lee's feel-good speech. He made no mention of the COVID-19 pandemic, which, despite his sentiments and those of like-minded politicians, is still very much a problem throughout the state. People are still getting sick, being hospitalized, and dying from this virus. The governor's own Department of Health reported last week that 65 Tennesseans were dying per day from COVID. And those of us who still care about public health continue to wear a mask in public, even though we are fully vaccinated and boosted. So let's be clear. Not talking about it does not mean COVID is history. Yet, Lee is on cruise control toward re-election this year for a second term. And in his mind, the less said about COVID, the better. I'm Otis Sanford, and that's my point of view.